Okay, I'm going to call to order the August 5th, 2019 meeting, regular meeting of the Haywood County Board of Commissioners. And our first order of business will be our Pledge of Allegiance, and after that I'll ask our chaplain, Reverend Patrick Womack, to come forward and give our invocation. So if everyone please rise for the pledge. Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
May we pray. Most gracious God, our Heavenly Father, we give you exalt your name together. We thank you for your glorious blessings of life and providing for us in ways that we don't even know how to ask. We ask your blessing on this meeting. We pray that you will grant to these our commissioners everything that they need to conduct the county's business in a way that will result in good for all involved, and that it also may resound unto your glory. Father, our hearts grieve this day as we consider the tragedy that unfolded over the weekend. We pray for those who are suffering the loss of life in the tragic shootings, but in the many other violent ways in which lives are taken from us. We pray, O Lord, that you will deliver us from evil. And we ask you, O God, that we may experience the goodness of the Lord in the land of the living. For we pray in your name. Amen.
Okay, thank you, Reverend Womack. And from now on, I'll try to test my mic before I start. That's the second time I've done that. Okay, our next order of business is the call to a public hearing for the approval of a refund to excise tax overpayment. And this is per North Carolina General Statute 105-228.37. It's to be held on August 19th, 2019 at 5:30 in the historic courtroom of the historic courthouse. And our county attorney's out of town. And Brian, you just want to touch on that because this is just kind of a formality.
Chairman, an electronically recorded deed was accidentally recorded twice, and per statute, to refund the excise tax requires a public hearing. That's the public hearing's slated for our next meeting on August 19th. If you have specific questions about it, Ms. Rogers is here. She can talk about any of the details.
Okay. All right. We'll set that for our next meeting. Okay. Our next order of business, our public comment session. You have 3 minutes to comment, and there'll be a light that when it turns red, you need to conclude your comments. Would anyone like to address the board at this time? I don't have anyone signed up, right, Candy? Okay, seeing no one, I'll close the public comment session. We'll move to constituent concerns, and then Tommy, I'll start with you if you want.
No.
Anything, Brian?
I had a few, but I've already spoken with Mr. Moorhead and took care of the issues.
Okay.
I don't have any.
I don't.
Okay. Under the constituent concerns, I wanted to ask our EMS and our law enforcement to maybe give a report on the search that was conducted. And last week, I guess, and had a great outcome. Greg and maybe is the Chief Deputy Haynes here?
Yes.
They maybe come up and kind of give us a little rundown of what happened. It'd be great. We appreciate all y'all's effort, and I know the family really does, and it was a great outcome, Greg and Jeff.
Thank you very much for allowing us to come speak about this. Between emergency services and the sheriff's office, we prepare for these things quite often. We think about them. We practice our craft, and the most important thing is that we want folks to know that we take every single emergency such as this just as serious as the next. From a lost person in the national park to a massive shooting, to a person that's having chest pains or anything just like that. So we have a lot of great agencies in Haywood County that can help folks when they have this type of need. And it's just a blessing, but also an expectation that you guys have, that we have this type of service. We don't yet know the exact number of agencies that supported this search and rescue in particular for Mr. Lynch last week, but we had upwards of over 30 agencies supporting that effort every single day, and it lasted for 5 days. So I thought that was to be commended, and sometimes I think the last few days we went over 200 people looking for Mr. Lynch on those last couple days. So it was pretty awesome.
Good morning, Commissioners. Very simply put, the commitment to excellence that your public safety has here in Haywood County is second to none in the state of North Carolina. The commitment of the people sitting on the back row back here and many others is shown day to day. Selfless, and they do their work day to day, lots of times many hours when we're all asleep at night and so forth. So with that, I'm very humbled to be part of this organization in public safety, and I say organization, not just the Sheriff's Office, but EMS and all the fire departments and rescue, our SAR team. It's a collective effort because obviously we have to collaborate and maintain and build those relationships, which are so important. So with that said, we appreciate the support that we gather from you and we garner from the county as well too, and the citizens, but it shows each and every day in their performance. And that goes without saying, in each and every discipline of public safety. So we're very grateful for their efforts and obviously very thankful to be able to deliver Mr. Lynch back to his family.
I was just curious. I noticed he was like a quarter of a mile from where if I read that right, he was about a quarter of a mile away. Did he know where he had been, or if he'd been going around in circles, or I didn't know.
I don't think we'll ever know exactly the direction of travel that Mr. Lynch took, but he was located about 3/4 of a mile as the crow flies. But as you know, around these mountains, that could be several miles of traveling to get to that 3/4 of a mile ultimate distance that we did locate him at. Yeah. We probably won't ever know exactly which direction he took. But I know that from experience in search and rescues here in Haywood County, and we have a lot of them, we actually have more search and rescues here than almost the collective of all the other 99 counties in North Carolina. So we've gotten really good at it, and we have some great teams that help with that. And from experience, we don't look for the lost person per se. We look for the clues that lead us to the person. And so in this case here, the teams began to find clues, and that, of course, is what led us to locating Mr. Lynch. So.
Well, I'm certainly glad it turned out well for everybody. That's a good news story.
Just a big thank you to you guys and all those on the back row. You know, it takes a lot of commitment, and it goes to show that when we pull together as a community in a time, no matter what color you are, political background, no matter what, you know, when you pull together, you can do great things. Thank you guys for what you do.
Yeah, and I think the good Lord was helping y'all because the weather was about as good as you can get. It was very warm. As far as at night, and it didn't really rain that much. Like, you know, we've had these thunderstorms, and it seems like while he was gone, we had very few of those. So I felt like, you know, we got a real big break there. And then I noticed it was a multi-state effort. We had people from as far away as Alabama, I believe, in the paper and stuff. So I thought that was great that people really in the whole region, I mean, multi-state region, were able to help. And then I'm kind of a surveyor, and we always are in rough terrain, and I can tell you, when you're in mountainous terrain like that, it's hard. Mm-hmm. It's just to walk, let alone with your gear and everything. Just for a person to walk through the woods, because you can step on a stick that's under leaves and fall down, and then there's holes that you can break an ankle in very easily and stuff. So. But I appreciate everybody's effort, you know, to do that. And I was wondering, could everybody stand that would participate so we could recognize you? Yeah. Okay. That's good. We appreciate that. And I know a lot of you were probably not, a lot of people weren't paid or volunteers that did that. Probably the majority was, I would guess. So, and you said most of the fire departments were able to come out, and well, that's great. Does anybody have anything else? Okay. Well, thank y'all. Appreciate the report too. And when you get that agency list, maybe forward it to Candy, and we can. I would like to maybe just put it, maybe recognize those groups, maybe have an agenda item or something like that, just to say these are the groups that helped. I think that'd be great to recognize them. So, okay. All right. Thank y'all. Did you? Okay. Yes. Thanks. Okay. We really appreciate y'all. Okay. Our next item of business will be our administrative agency reports and presentations. And the first item under that category is the introduction of new county employees, and we'll have our county manager, Bryant Moore, to do that at this time.
Thank you, Mr. Chairman. It's busy. We bring 15 people on board. Emergency Services has 8, none of which could be here, but they are Gregory Gifford, Matthew Wyndham, Brittany Masters, Rebecca Pritchard, Ashley Godbold Hyde, Dylan Kaiser, and Shenandoah Ragsdale. From Soil and Water, we have Dana Miller.
And please stand if you would, Winnie. Okay.
Health and Human Services, Sarah Penland. Vasquez. Land Records, Nancy Hogman. Tax Assessor, Michael Carver. Sheriff, Jennifer Robertson. And Development and Facility Services, William Cole. These are our new employees for July.
Okay. We appreciate y'all coming to Haywood County and helping us out. So, okay. Our next report will be from VIA, update on changes to involuntary commitment law and mandated community crisis plans. And VIA is our mental health organization for our community. And we have our Western Region Community Relations Representative, Shelley Foreman. And you come here about once a year or once?
Yeah.
Twice a year?
Well, I've got good news and then some challenging news. But the first thing I wanted to do, and I included just some very brief materials in your packet, although I will say County Manager Moorhead and Commissioner Pless have gotten probably more extensive information. In the last legislative session, there were changes to the involuntary commitment laws, and that is Senate Bill 630. And there were several goals of that plan, namely to expand the number of professionals that could do that first commitment exam for people under involuntary commitment petitions. It also seeks to try to divert as many people as possible from the emergency room for that first exam unless they have a medical condition. And it also did several things that both the county and VIA have been working on. In the past, community crisis response has always occurred, but it's always been more informal. What the Senate bill required is, one, that counties develop a written transportation plan for the transportation of people under involuntary commitment petition. Traditionally, the Sheriff's Department has done that out-of-county transportation, and of course that can still occur, but it asks that the counties develop a plan between law enforcement, the LEOs, the hospital system, and magistrates to just put in writing what their transportation plan will be for people under involuntary commitment. That plan will be included in what's called a community crisis plan. VIA Health, in its role as the agency managing state and Medicaid funds for people with mental health and substance use issues, was charged with bringing people together in the community to develop a written community crisis plan. to do that, we started working with Chancellor Collaborative. You all have heard of probably Lanier Chancellor, who was a Department of Health and Human Services secretary for a long period of time. And what we did is we started this process with talking with people in the community who are directly impacted as far as law enforcement, again, magistrates, the hospital system, our crisis services providers, and VIA. We did this by having a focus group setting. Haywood County had great participation from people in your community. We brought people together to hear about what's working, opportunities for improvement, what would they like to see in the community crisis plan. We have now developed a written draft report, which VIA will be reviewing internally for the final time on Wednesday, which will then be sent out to all the participants of the focus group to get input and feedback. And those plans, our community crisis plan, along with the transportation plan, are due to the Department of Health and Human Services on October 30th. So just wanted you to sort of have an update of where we are in the process. I will say VIA is very clear that we heard what's working well. In Haywood County, we're lucky to have the behavioral health urgent care, which can do that first commitment exam 24/7. Haywood County Sheriff's Department has an officer on duty who can actually take custody of people at the behavioral health urgent care, so other counties can get back on the road, or the sheriff's deputies can get back on the road. We have the inpatient unit at Haywood Hospital, as well as walk-in centers. So Haywood County has probably the fullest community crisis continuum of any county in the West. Of course, the BHUC is available to all 7 counties, but being here in Haywood County, there have been a lot of good protocols that have been worked out for its use. So you will be seeing those plans coming out for review. We'll be talking again with County Manager Moorhead just about the status of the transportation plans. There was a lot of confusion around that. I think the first memo went out to the Association of County Commissioners, which then sent it to counties. I'm not sure all the counties actually got the memo, so VIA's tried to let them know that this will be due and will be included as part of that plan. So that's where we are with that, and it will be due October 30th, and obviously you all will get a final copy of that plan once it's signed off on by all the participants and required signatories. Before I start on some of the funding reductions that we see in our horizon, I wanted to mention 2 really positive projects that VIA Health is working on in collaboration with key partners in Haywood County as well as our providers. One of the projects is special funding for the Haywood County Health and Human Services Department, a Health and Human Services Department, to provide assessment and best practice treatment for people who have an opioid diagnosis. This would be people who are involved in the DSS system. We've had several meetings. We have most of the details worked out. We're waiting for our final allocation letter, which spells out exactly the requirements of that. This funding is special funding and falls outside the state funding that I'll be talking about later. So we believe that money will be, there will be no change in that funding. The great thing about it, it'll not only fund treatment for people that choose to do medication-assisted treatment, it'll also pay for those medications. So that's a very positive thing, because many times people can't afford the Suboxone that is usually what is prescribed as part of that process. The other project, which I did get permission from Sheriff Christopher that I could say something about it, we received word the week before last that we were also going to be getting a special allocation that would be designated for Haywood County and their detention center to explore with them how we can introduce substance use support, substance use treatment into the detention center model. So we are very excited about that, because we know many times people come in the detention center, they may have substance use issues, and if we can do some really good programming and treatment there, hopefully we can assist them in connecting with resources post-discharge from the detention center. You have great programs here like Pathways, and that will be able to then keep them from coming back into the detention center because of their addiction issues. So those are 2 special allocations. They are coming coming from a different funding stream than what I'm about to talk about. So we're fairly certain that there will be no impact on those programs. And I know we'll be back talking more about those once we get the details worked out. So many times when I come before you at this time of year is to talk about the state funding reductions that the General Assembly is implementing. As you know, VIA Health manages Medicaid funds. Those are an entitlement. Those are set-aside funds that we get. We get a per member per month for people who qualify for Medicaid. We also receive funding from the General Assembly for people who have no insurance, who do not qualify for Medicaid, and need mental health, substance use, or developmental disability services. Those funds are in high need in our area. I should have brought my graph. Brian Ingram, our CEO, we have this many people and this amount of money. Over the last 4 budget cycles, we have lost $48 million in state funding reductions from the General Assembly. What we know is, especially with substance use issues, that the vast majority of those people, especially people of the male gender, are not on Medicaid. Sometimes women, if they're pregnant or parenting, can have access to Medicaid for a period of time. But many of the people who struggle with addiction do not have insurance, do not have Medicaid. So as we look at this upcoming year, as you know, the budget has not been approved by the General Assembly. We're into August and VIA has no budget. In the talking points I gave you, it looked like the proposed funding reduction for VIA would be a little over $6 million for this coming budget year and an additional $6 million for the next budget year. What we're hearing now, it's going to be about over $9 million for this year, with it recurring the second year for an 18-some million dollars. So what does that mean for the community? Over the past, VIA, as any organization that's a public agency, has a fund balance. The vast majority of our fund balance is restricted for a variety of reasons, as you guys would know, as having a county fund balance. Over the funding reductions for the past, actually it's been more than 4 years, it's been 6 years, we have continued to, instead of being able to expand services through the cost savings we've seen through Medicaid management, we've basically had to backfill. So every time the state General Assembly took funding, made funding reductions, we said we don't want people to lose services. So we've used our fund balance to do that. After 4 to 6 years of that and coming up such a huge amount in the next 2 years, I can tell you that VIA no longer will have the ability to meet that 100% of filling those state funding reductions, allergies. So I wanted you to be aware that, one, if these funding reductions go into effect, VIA will have to look at what services we will have to reduce. Unfortunately, those would be things that are funded through our state funding, and your local funding goes to also support, which would be the walk-in centers that we have in every community. It could impact the behavioral health urgent cares. It could look at other programs like community crisis and mobile crisis management. So all of those programs that we use our state funds to provide would have to be on our list of things that would have to be reduced, as well as state-funded services for people with developmental disabilities. So what I did provide for you, one of the things that all of the organizations like VIA across the state and many of our statewide provider organizations has started a Care for NC campaign, and these are the documents that look like this. We've had many people advocating on our behalf at the General Assembly, but if you as a group feel any compulsion to support us in asking the state to stop these funding reductions, we would certainly ask for your help and support. At this point, we don't know if that would have any impact or not. It doesn't look like there's been any movement in addressing funding reductions or going back and reviewing it. So I just sort of leave it there until the budget is passed. We don't know. What we do know is that our budget started July 1st, so any funding reductions we have are going to have an impact over that shorter period of time. We're hoping the budget gets passed by the end of this month, but we don't really know. So these state funding reductions will have a direct impact on your community, and we will do our very best to fill in where we can and to use our fund balance. We provided a chart for you which shows the VIA fund balance and the amount of operating capital, the days of operating capital we have on hand, and you'll see that we're not wealthy, and we only have so many days of operating cash, and so we have to be very careful as we look at this reduction. We also have to prepare for Medicaid Transformation, which I hear you're going to hear a little bit more about in just a few moments. So I'll stop there and see if you have questions. If you have any, I know you will have concerns if this happens, but this has been a trend over multiple years, and it's just becoming a very challenging situation when Medicaid has not been expanded to include these people, and the General Assembly is reducing funding over such a long period of time.
Does anyone have any questions? Go ahead.
Oh, I was just going to point out, I mean, so in your statement in the Care for North Carolina, you'd indicated that there are actually 2 million plus North Carolinians receiving this critical care. Mm-hmm. So does that mean there's 2 million people in North Carolina that have been designated or diagnosed with some type of behavioral health issue?
Yes. It's a staggering amount. I mean, we know with even depression, 1 in 4. With addiction, I mean, we've seen the explosion with the opioid issue of more people having to face that. And many times, the people with addiction issues do not have insurance. And we know, for instance, and you probably know your data better than I do, but if we look across our catchment area in Western North Carolina, we have a higher number of people with no insurance or no Medicaid than many other places across the state. So it's a double-edged sword for us. And when we talk about the community crisis plan, 70% of the people who are seeking crisis care for a mental health or substance use issue, 70% of those are indigent with no insurance. I mean, it's just the math of it. Long-term reductions, a growing number of people, and the services are not there. Will people get services? They'll get services in the detention center and the hospital ED, and they'll be cycling in and out.
Okay, so explain to everyone here, what does VIA do? I mean, I know what the Sheriff's Department does, I know what the police departments do, I know what the hospital does, but how do you interact with them?
Sure.
And also, because of the lack of funding, I mean, obviously that puts pressure on the police department, the Sheriff's Department, the county, as far as taking care of those people, because they're not taken care of otherwise. But what, if you got that money, what would you do with it?
Well, first, our role, we are a public managed care organization. We used to years ago provide mental health and substance use services. Over time, the state of North Carolina turned our organizations into organizations that manage the funds through the General Assembly for these funds as well as Medicaid. So what we do is we contract with providers to deliver those services. In Haywood County, your 2 primary behavioral health providers are Meridian Behavioral Health and Appalachian Community Services. Those 2 organizations get the vast majority of state funds, the indigent funds. They provide both the walk-in center care, the community-based treatment care. They also do the crisis response, mobile crisis management. We have other great providers that we contract with, but they're the 2 large comprehensives that get the vast majority of state funds. So we also have care coordinators. Those are people who work for people who qualify, who are in and out of the hospital, to try to link them with services, to try to connect them, but they're more of an administrative connective service. So really, our state funds are focused on those 2 comprehensive care providers. So what would it mean if state funding reductions occur? It means that the money we give them would be reduced. So their services, whether it's walk-in centers, whether it's psychiatric care, whether it's the medication-assisted treatment programs that people are getting, whether it is it's called assertive community treatment and intensive outpatient treatment. Those are the highest level of services before inpatient that people can get in the community. We would have to look at how those funds would have to be reduced. Those are people who would definitely have impact on your system. So anytime there are less funds, there's less we can do and our providers can do because we have less money to give them. You know, what in a perfect world, especially in the world we face now, if we had full funding, we would be able to do more in the form of outpatient treatment, as far as community-based treatment, people who need care. Instead of our providers having to limit the slots they have for state-funded people, we would be able to expand them so they could afford to provide more care for people who have no insurance. Because right now, we want our providers to survive and they have to balance their budget. So, you know, they get all of our money, but they can't just provide free service. So if we had more money, they would have more ability to provide services across those continuum of care.
Okay, thank you for that explanation.
So the state we have this opioid crisis, and they're decreasing funding instead of increasing it, is what you're saying?
Yeah.
What's their reasoning for that?
I think the whole world is focused on Medicaid transformation and sort of looking at Medicaid versus people who are indigent, which we will still have to manage. I think the other thing is that we feel like we've been a good MCO in that we have constantly reinvested any cost savings in Medicaid into community programs that also serve the indigent. I think where there are several legislators who sort of got into feeling bad about what we do and not supporting MCOs with the cardinal behavioral health sort of I don't want to say fiasco, but as you know, Cardinal MCO is a big MCO in the middle of the state, and the Department of Health and Human Services went in and took over management of them because they were found that they were paying extravagant salaries, they were taking their board on extravagant trips, they weren't using their funding as much as they could have been for services. So that sort of put a bad taste in everybody's mouth. But if you look even at that spreadsheet I gave you, you can tell which of the MCOs is Cardinal by the amount they have in their fund balance. And I think it's just one that, you know, that was an opportunity to say, spend down your fund balance, which we have always done, and we are using our fund balance, but now we're to the point where that money is no longer available. And two, what we know is people with mental health and substance use issues don't advocate for themselves. They're not sitting at the General Assembly like school teachers and others saying we need funds. And so I think it's sort of a forgotten population. And, you know, VIA's tried very hard to make up for the funding reductions, but, you know, the math of the degradation over time is just not working.
Provision, you know, if things like that's going on, looks like they would. You know, the state would have supervision over, you know, these groups like you're talking about, to where they can't be doing what they were doing.
Yeah, one bad apple shouldn't,
And you said something about walk-in centers?
Yes.
So somebody, you know, like if we know somebody that needs some help, they can just walk in?
Yes, the main walk-in center, Meridian, has a recovery education center, which is a great resource on Walnut Street. People can walk in. Now, they do have business hours, you know, 8:30 to 5, although the behavioral health urgent care is open 24/7, and that's on Balsam. They can go to that 24/7. Appalachian Community Services also has a walk-in center over across from the Kmart Plaza. So people have places to go. And we have most of the agencies in this community really know how to make connections. The Department of Health and Human Services, the Health Department, law enforcement, many others, they know who our providers are and how to help people. So Haywood County has a really good collaborative relationship, but these people sometimes are the hardest to serve and struggle. So.
Right. Well, that's good to know. I know some folks need to take advantage of that. So, okay. Does anybody else have any other questions?
So more to come. Thank you so much.
Thank you.
Okay. Our next item of business will be an update on Medicaid Transformation. We have our HHS SA Economic Services Division Director, Teresa Allison, this morning. Hey.
So good morning, everybody. Again, I'm Teresa Allison. I'm the Economic Services Division Director at Health and Human Services. And with me also is Ira Dove, our Agency Director for Health and Human Services. We want to take the next few minutes to talk to you a little bit about Medicaid Transformation, some major changes that are coming about in the Medicaid program, and how that's going to impact our citizens.
Do you want to start?
Okay. So in 2015, the General Assembly enacted Session Law 2015-245, which directed the State Department of Health and Human Services to transition from Medicaid fee-for-service model to managed care. Now, what exactly does that mean? In today's model, which is fee-for-service, it's also called Medicaid Direct today. That means that providers are paid for the services that they provide or the procedures that they order. They bill directly through a computer system called NC-TRACS and are reimbursed for their services. Under managed care, instead of contracting directly with providers, the state's going to contract with insurance companies, which are called prepaid health plans. These prepaid health plans will assume responsibility for overseeing the health care needs of all of the individuals that selects them as their plan of choice. All right. In Haywood County, we have just over 14,000 citizens that receive a Medicaid benefit. Out of that, roughly 14,000 citizens, approximately 8,400 to about 8,500, I've seen different numbers, so it varies a little bit, will be moving from our current model of Medicaid Direct to managed care. There are some group of individuals, roughly 2,700, and again, this is a projection and a best guess for Haywood County. There will be some groups that will be temporarily exempt from this initial rollout and will transition at a later date. There is also about 3,000 individuals that will not be able to enroll. They'll be excluded groups, and some of those would be those, for example, that receive family planning services only, those that receive refugee Medicaid, or those that receive health insurance premium payment, which is basically a program where the health insurance premium is paid so that the individual can keep their private insurance. Changes for beneficiaries in managed care. The Medicaid services under managed care will now be administered by the health plans, as I said just a minute ago. The beneficiaries will be able to choose their health plan and also select their primary care provider. Non-emergency medical transportation will become the responsibility of the health plan, and I'm going to get into that in a little bit more detail in just a moment. So let's talk a little bit about non-emergency medical transportation. As it exists today, when an individual has transportation challenges or barriers that could prevent them from being able to get to and from their doctor appointments, to the pharmacy, et cetera, North Carolina Medicaid directs social services agencies to help coordinate and facilitate and arrange for transportation to those individuals that qualify for that service and do have legitimate transportation barriers. So what does that look like for us in Haywood County? We contract with multiple vendors who provide those transportation services. When an individual indicates that they have some transportation challenges, then we have dedicated staff that will arrange for that transportation using the most cost-effective means. They have to be sure and verify that that individual is in fact going to be receiving a Medicaid-covered service in order to get that trip assistance. Okay. And then once that service is rendered and the vendor has transported that individual to and from their appointments, the vendor will then submit a claim through NC Tracks and get reimbursement for that transportation service. That's how it works today. Now tomorrow, or well, actually more specifically February, for those individuals that are moving to managed care, the prepaid health plans will be providing that transportation service. We at Social Services will not be involved in that part of it whatsoever. The providers and the vendors will be contracting directly with the prepaid health plans or through their brokers, and it's my understanding that each of the four are going to be using a transportation broker to assist them. The vendors will also be working with the prepaid health plans or their brokers to establish their rates, and they will conduct all of that business with the prepaid health plans. Now, that doesn't mean that Social Services will be getting out of the transportation business altogether, because as I mentioned just a moment ago, there are some populations that will be temporarily exempt or excluded. And for those that would qualify for transportation, we will still be responsible for coordinating and arranging for that, just as we do today.
As you heard a moment ago from Ms. Foreman and have been talking with Teresa, there are some services that won't be covered by the Medicaid Transformation Program. The first group I'm going to talk about, we have the slide here, but the first group I'm going to talk about was mentioned by Ms. Foreman. They will still be handling a large segment of the population that is not put into the regular plans. Via Health will be in the other MCOs. We handle the tailored plans for people with the higher behavioral health needs. And there's a point of demarcation. A lot of the mental health needs, the minor mental health needs, will be met in the regular plans by the four providers that Teresa's going to talk about in a minute. But Via and the other LME MCOs will still have a group of folks that they'll be dealing with. So you'll still have some of your population that will be dealing with tailored plans, with the plans that we'll be handling, and with the Medicaid Direct, and then the standard plans that we're going to be talking about. So we have kind of three different groups. It's going to be a little confusing for our populace as they go forward, but just putting that out there now. In addition, there are Carve Outs, and Teresa mentioned a minute ago, a few slides back, of people that would be excluded from the program. So they just mentioned some of the major carve-outs that people, when they look at, may be interested in. The services they get from the Children's Development Services Agency, those are not going to be Medicaid covered. Dental services, with the exception of two of the programs, the end of the mouth of babes being one of those, will not be part of this Medicaid transformation, and then the fabrication of eyeglasses won't be either. So those are going to be carved out things, along with the other exclusions you saw a little earlier.
Okay, so let's talk about the four health plans for North Carolina managed care. First, you have AmeriHealth Caritas North Carolina, Healthy Blue, United Healthcare of North Carolina, and WellCare of North Carolina. All right, so let's take a look at the map showing what the timeline looks like. If you look at the areas in yellow and red, there's roughly 27 counties that are in phase one of the rollout, and their process has already started. As a matter of fact, right now, they are in the middle of open enrollment for the beneficiaries in their counties. For the rest of the state, starting with Region 1, of which we are a member, Region 3, Region 5, and Region 6, the timeline as it stands right now will begin on October the 1st with open enrollment between October the 14th and December the 13th. And then the effective date of implementation will be February 1st, 2020.
Who's contacting these folks about open enrollment?
The beneficiaries?
Right. The people that need this care, who's responsible for contacting those people to say, you need to do this?
Okay.
I mean,
So
because that's a difficult populace
it
to
certainly
get to do
is.
that.
I agree. So starting for our county in October, right now it's slated to be October 1st, a packet of information will be mailed out from the enrollment broker, and it will go out to all of the Medicaid beneficiaries that are going to be subject to moving to managed care. And it will give them some information about how to contact the enrollment broker, how to get information about the health plans, about primary care providers, and help them make a choice. Now, it is going to be very important. I think my message to our citizens would be to pay attention to that information, read through it, ask questions, and find out how the plans are like, how they're different, so that they can make the right choice for them. Now, we also plan to have individuals in our agency at Health and Human Services set aside to answer questions for people as well. So we're not going to depend solely on other folks to do it, because we really understand the importance of making sure people understand these changes and how significant they are. So there will be a variety of ways that they'll be able to get some information, get handed off to an enrollment broker. The one thing I do want to say is that my staff will not have the subject matter expertise to be able to discuss the prepaid health plans in great detail to the extent that our beneficiaries will need. But we will help them get connected with someone at the enrollment broker who can discuss that information and help them make a choice and help them get enrolled when they're ready to do so.
And if they don't get enrolled, what happens?
After the open enrollment period, which for us runs October 14th through December 13th, they will be auto-assigned to a plan.
To one of those particular plans that one of the 4 or 5
One
plans.
of the 4.
They get automatically assigned to them.
Yes, sir. That's correct.
Okay.
Okay. And let me say also that there is a 90-day window of opportunity for individuals once they have selected a plan or been auto-assigned to a plan. If that plan turns out not to be the right one for them, they'll have a 90-day window of opportunity to select a different plan. That will happen at initial determination of eligibility, again at when the eligibility is redetermined, and then there's some select circumstances that might change and warrant a different selection. All right, and then as I said, last but not least, our implementation date is February 1st, 2020, which will be here before you know it. Mm-hmm. Okay, so Health and Human Services will continue to be responsible for determining eligibility, redetermining eligibility, and reacting to changes. That process will not change at all. The qualifying criteria to be eligible for Medicaid is not changing. So on the very beginning end of it, there will not be any changes. And as I had said earlier, we're still going to be responsible for providing non-emergency medical transportation for those individuals that remain in Medicaid Direct, and we will still be responsible for ensuring that they get replacement Medicaid cards if they lose theirs, and update any primary care provider changes. We will not be the ones that will be doing the choice counseling. That will be the responsibility and function of the enrollment broker. We will not be enrolling members in plans. We will not be providing transportation for managed care plan members or updating plan or primary care provider information. Also be the function and responsibility of the health plan to generate any replacement Medicaid cards for those that are in using their services. Okay? All right. On this slide, it almost looks like the entities work independently of each other, but that in fact is not going to be the case at all. There's going to be the need for considerable amount of communication and coordination between Health and Human Services, our agency, who again will maintain responsibility for the eligibility functions, and then the enrollment broker, who will be providing that choice counseling and help individuals get into a health plan and also choose a primary care provider. Then the health plan will be the one that will be overseeing the health care needs of those beneficiaries and arranging the transportation, helping them with any primary care provider issues that they have. Now, one thing I do want to say is that NCFAST, which is our current automated case management system, and our agency will be responsible for keeping track of current demographic information, so address changes, telephone number changes, that sort of thing. It will be very important that we keep that information current because NCFAST will be the driver of where mail goes and that sort of thing, as an example.
Can I stop right there and ask you a question? On this enrollment broker, is that going to be a representative from these private companies that are going to provide the services 8,500 of our residents? It's going to be rolled off of that? That enrollment broker, who do they work for?
Okay, that's actually an excellent question. The enrollment broker is Maximus. Maximus is contracting directly with the state, and one of the criteria when the RFP went out was that the enrollment broker would have no affiliation with any of the health plans whatsoever, would not have any vested interest in the selection of whoever that each individual chooses. So they are completely independent.
Okay.
Yeah.
Thank you.
Sure.
Okay. Our Public Health Services Division will be impacted by this process as a provider. However, we'll still be performing those safety net functions that we do for our citizens. There are a lot of services that are not tied to Medicaid transformation. We'll still be doing the communicable disease stuff that we do. We'll still be doing the environmental health services and going out and checking wells and stuff. We'll still be doing WIC, the school nursing program. So there's a lot of services, dental, immunizations that we will continue to do that are not tied to Medicaid. And we will be working as a provider with those companies for the other services that we can bill Medicaid for. You know, some of the well checks we do and some of the other things. So the health department is going to continue. They will be impacted by this, but not to the extent at this time in these initial phases that the social services side and the workforce there will be impacted.
On this slide is a website that anyone can go to. It's a public website that will provide detailed information about Medicaid transformation and the changes that are up and coming and give everyone some basic information. The one last takeaway that I want to say about Haywood County and how we want to communicate this information to our beneficiaries. We are planning an outreach event. Sometime the date is fluid because as the state makes changes, we have to react accordingly, but sometime during the open enrollment period, tentatively late October, we would like to have an outreach event at our agency, invite members of the public to come. We will have representatives from each of the 4 prepaid health plans, and we've already reached out to them, and they've said, yes, we'll send a representative, as well as a member from the enrollment broker who can also provide some assistance. So stay tuned for more details about that as we get a little closer to the date. Any questions?
I know Chairman Inslee and myself were in a meeting the other night, and that linear counselor, I think Ms. Foreman mentioned earlier, you know, it's 2 different discussions. Medicare transformation, Medicare expansion, 2 different deals. Medicare transformation's coming. And I feel sorry for your front desk operator, because when those things get mailed out, I'm sure your phone is going to just continue to ring off the hook. And so, you know, we got Medicare expansion.
Medicaid.
I mean, Medicaid, yeah. I said it wrong.
I get it mixed up too.
But yeah, it's 2 different discussions. So 8,500 are going to be coming off our 14,000. So that's pretty a big deal for our county. It's going to be rolling over into a private provider. So.
It is going to be a big change for them, very different than the way we have operated Medicaid in the past, for sure.
Yes, and we will still be doing the eligibility functions and the redetermination of eligibility. So it's really, they'll be rolling off in terms of like the payment side and getting managed. The workforce will still be quite busy with making sure that those people stay eligible for Medicaid, because those redetermination functions will fall on us.
So who's going to pay for that plan?
Who's going to pay for the plan?
Well, right now, I mean, the state and the federal government pay for the Medicaid. So if it switches over to the private plans, who's going to pay?
These will be.
I mean, they're not going to collect premiums because they don't collect premiums from Medicaid. So there's no money going in. So where's the money coming from to pay for the services?
The health plans will be paid a per member per month rate to provide their services from.
By the state?
Yes.
Yes. So it's just taking money out of one hand and putting it in another, really.
Yeah. So they're getting rid of iHealth they're getting rid of portions of that, but we're going to give money to the private sector so they can determine how much those services should cost.
Correct.
Yeah. That's going to work out real good.
It's going to be an interesting, but that is the transformation in how the providers work. And for people, knowing that, one of the things they'll need to pay attention to is what providers are in what network.
I noticed in the value health and this also, there's a lot about transportation for mental health patients and involuntary commitments. We're going to shift that from the burden of our sheriff's department. There are going to be some more independent private providers, and they'll be reimbursed by the state, out of the state funds. Did I hear that correctly? It's going to be moved over more into
We're talking
private
non-emergency medical transportation,
Yeah.
which is going to be different than involuntary commitment transportation. Many of us would wish what you just said, and having people that were paid sitting with those folks because of the cost of the county governments. But I believe these are separate issues. This would be someone needs to go to the doctor. They have no transportation, or we often get some people may need to be transported to like Wake Forest Hospital, and they don't have anybody that can get them down there and back. Not emergency. It might be an important surgery, but it's not something where they have to be rushed to the ER. So they'll provide the transportation.
I have a couple of questions. Yeah, go ahead. At the end of the day on February the 2nd, is it going to increase your workload or decrease it?
At the end of the day, I believe that the Medicaid transformation initially is going to increase it. and when it restabilizes, depending on what happens, you'd mentioned, I'll keep expansion out of the conversation because that would definitely increase it. I think it's going to make it a little different. There may be a slight increase. I don't see a decrease coming out of this because we're still going to be doing eligibility. We're still going to be doing redetermination. One area that we've been able to do is, I believe we now do a lot more heavily involved in non-emergency Medicaid transportation. So we took one of those positions when the person retired to help cover up one of the holes we have in Medicaid now because we're a little short-staffed. So in anticipation that our workload will decrease, we've already moved one of those positions over. So it'll make it a little bit different, but I don't know how much of this project after a year from now, I don't know the net gain. In the next year, it's going to increase it because I anticipate exactly what you said. The front desk is going to be very busy, the other things. But I think that the net out a year from now, just on Medicaid transformation, I don't know that it'll be a huge swing one way or the other.
It'd be nice to stay ahead of it because I know it's going to be very frustrating, people trying to figure it out. And if they don't get the resources they want and need, they're going to have to lash out at somebody because they don't think they're being serviced. The health plans, do they require those four to have people in Haywood County offering services, or are they going to be in a situation to where I've not heard of any of these other than United Health? Are they going to be required to go outside the county to seek care now that they're falling into this? That would put them back to having to transport people because they have no other way of getting there. Do you see that as being a problem?
They have to offer the ability to contract to everybody, and the question is going to be what those contracts look like for the individual providers and what they take them. Healthy Blue is Blue Cross. That's a division of Blue Cross. So honestly, I am not sure if all providers will choose to take contracts with all of the insurance groups. And it's going to be like they are today when they're out there negotiating with these different insurance groups. Many of our local providers negotiate with the private insurance groups already. And so they're going to be doing that to see if they get in the network, because you're really in a managed care going into a network system. So will some people's providers not be on some insurances a year from now? I think that's a high possibility, but depending on what kind of contracts they're offered and what they can work out. But will there be providers in at least some of the networks in most of the areas in Haywood? Quite a few people today in Haywood take the Blue Cross and the United Healthcare and stuff like that. So I think that they probably will work out with some.
Do you know of a way, if this becomes a problem, that we're going to be able to address that? That's my biggest fear, is people are going to be forced into a plan, and then they're going to be told, you can't have it. Is the state going to allow us to address that just because they can't set up the network?
They're going to be required to set up some kind of network, whether it's the kind of network. I think the addressing would have to be done at the state level, because they're the ones who will have the direct contract at that level and determining whether or not those insurance companies have met their obligations in setting up their networks. But they're supposed to offer every provider that's presently taking in the Medicaid system the ability to take their plans. It's just they will be able to negotiate rates on many of the things. So that's, if they don't, that would be, I think we'd have to be talking with state players that are over the contract.
I think, Brian, you had a question that would be pertinent to the county.
I had heard rumor that the state was going to monitor how our health plan will track here in Haywood, other counties, that if the actual costs of the plan exceed projections, that the counties will have to pay something in outlying years. Is that true, or was that just a discussion?
I have not heard that in the different trainings. I've been in a number of them where they've brought in Maximus, and they brought in, and I've met, the enrollment brokers, the higher level folks, and also the different folks for these 4 plans, and heard stuff directly from the state. I've not heard anything that said the county would be paying an overage based on Medicaid transformation. I have heard on the eligibility side that we can, if we can be responsible for things, but I can check into that. They pull us into mandatory stuff a lot, and including next week, if I'm not mistaken, they have we have to go through another one with the state. So I think that's an excellent question I can ask. Or is there a plan to ever make the counties responsible if the state can't fund this? And the other thing I can say is there's a precedent. You just heard about that a few minutes ago with the LME MCOs when there was the way that system was. There's a precedent in having another entity's fund balance backfill. So, but I don't know that there's a specific bill on target for that.
Yeah,
but I will ask.
Used to, counties had to pay 5% of Medicaid cost. And it was hard because we couldn't even budget it, could we, Julie? You couldn't even, you could have a budget number, but I can remember doing huge budget amendments towards the end of the year because it was a lot more, and it was always more. And then the state, I think Ray Rapp and some of the others back maybe 2028 or 2010 got the Medicaid. We were the only state that had to do that. In other words, the feds paid so much, the state paid so much, and the county paid 5%. Well, most states, all the states except for, I think, North Carolina and another one or two, basically the state and the federal paid Medicaid money. And so we finally got the Medicaid away from the counties. So we didn't have to try to come up with that 5% match, which was millions of dollars, maybe, Julie? Or?
Yeah, it was becoming over $3 million a year.
Right. So
it would have been way more than that at this point.
Yeah.
I would say 5%. Just the pharmaceutical for Haywood County is closing in on $100 million, so you'd be 5 before you even counted anything else.
So the state did a favor to us when they did that. I think they did take something back, but
They took our half-cent sales tax.
Okay.
And our half-cent sales tax at the time was bringing in less than the Medicaid was costing us, so it was good for the county at that particular time. And with Medicaid going up as much as it has, it's still better.
Yeah, I agree, because that's just exploded.
Yes, unless they change it.
Yeah, I was glad when they did that because it was a budget buster all the time.
It was. It certainly was.
But but we've not had to deal with that. But it almost seems like what Bryant's saying is we're going to come back if we have to start doing overage. I could see that happening. So that could be that's tough on your budget. Medicaid is. So does anybody have any other questions?
No, just a comment. I'm on the HHS board, so I stay up to date on a lot of this. But I think as we move along, it might be a good idea for you guys to come back and update us, to let us know where we're at, so that a lot of the questions that's been asked today maybe could be answered. So thank you for what you've done, but as we go forward, I think it'd be good to give updates.
Yeah, that's good. Yeah, okay. Thank you all for coming this morning.
Thank you.
Okay. Okay, next item of business is our discussion adjustment to the agenda, and I have none. Does anyone else?
No, sir.
Okay. Okay, the next item of business will be our consent agenda. I'll read through these, and at the end, if y'all have any questions, we'll go back and address those, because we do have staff here to address them. Our first item of business will be the approval of the July 15th, 2019 regular meeting minutes. The second item is the request approval of an updated land records GIS service and product fees, and that's under attachment 5. The third item is to request approval of a waiver of $75 for a billing permit fee for nonprofit Fines Creek Community Association to build a handicap ramp at the Fines Creek Community Center, and that's attachment 6. And we do this for you new commissioners. We do that from time to time. The fourth item of business is to request approval of a designation of Commissioner Tommy Long as the voting delegate attending the NCACC Annual Conference on August 22nd through 24th, 2019, and that's attachment 7. And I know we appreciate Tommy being willing to do that. Our fifth item of business is to request approval of a resolution to declare a 2005 homestead trailer surplus and to convey the trailer to the Haywood Community College for use in the Public Safety Training Center's Driver Safety Program, and that's under attachment 8. Number 6 is to request approval of the 2019-2020 contracts for information technology, all to be paid from budgeted funds, and we have 4 of those. The first one is BITAC tax software and support maintenance agreement in the amount of $58,710, and that's attachment 9. The next one is Laserfish recording imaging software and support maintenance agreement in the amount of $26,124.91, and that's attachment number 10. The next is the Cronus timekeeping software and support maintenance agreement in the amount of $26,544.84 under attachment 11. The fourth and final is the Tyler Tech Munis finance software and support maintenance agreement in the amount of $76,051.08, and that's under attachment 12. And this is all for our IT department. So having read all of those, does any of the commissioners have any questions or comments about any of those? Okay, hearing none, I'll entertain a motion to approve the consent agenda.
So moved.
Okay,
Second.
Okay, any other discussion? All those indicate by saying aye. Aye. Okay, and that's unanimous. Okay, our next item of business will be our regular agenda, and the first is to request approval of the Juvenile Crime Prevention Council annual plan and certification documents, and we have our district guardian ad litem supervisor, JCPC Chair Brad Reniger here this morning. Okay. We appreciate you coming this morning. And this will be under attachment 13 in our packets.
I understand that y'all have the copy of whatever it was that we were supposed to submit, and I think we're just looking for approval at this point for the updated roster and certification.
Okay. I know, let's see, Mark, you're on that board, right? Yeah. Okay.
Do y'all have any questions for me?
Anyone have any questions or comments? All right. Okay. Okay, hearing none, I'll entertain a motion that we approve the request for the JCPC annual plan and certification documents.
So moved.
Okay, is there a second?
Second.
Okay, all those in favor indicate by saying aye.
Aye.
Okay.
Thank you very much.
Okay, thank you. Okay, the second item of the regular agenda is to request approval of the 2018 settlement of collections. We have our tax collector, Greg West, here this morning, and this is something that we have to do, I believe, every year about this time.
Good morning, Commissioners.
Morning.
Mr. Chairman, I'm here to request approval of the 2018 settlement of collections. Our net levy for the 2018 tax bill was $40,600,871. We've collected $39,697,396. Remaining balance is $903,519 for a final collection rate of 97.77%. Last year, final was 97.21. We've also collected over $200,000 in July. That's not shown on this report, but be glad to answer any questions.
Okay. Anybody have any questions for Greg?
At least the amounts that weren't collected this year, can you give an idea of what it's attributable to? I mean, are there a few people with multiple properties? Is there a large property, or, it's the same delinquents that we've run into in the past?
Yes, it's a combination of all those. I mean, there's a lot of personal property out there that sometimes is difficult to collect on, but there's not a lot of large amounts. It's small amounts that add up. I mean, last year the remaining balance was 1.1 million, and we're 900,000 this year, and we've collected 123 of that, 123,000 in July of the 900 remaining. So we're down around 700.
That's great.
For 18's remaining balance.
Okay.
We have staff is great. I'd like to recognize them: Terry Watkins, Tanya Bailey, Chris Hill, and Cindy Sheffy. They've done a great job working with the public, communicating with them so that we can do our best to collect this amount.
I do appreciate, I haven't been getting any calls that you weren't doing your job, so I appreciate that. I appreciate y'all working hard and doing what you need to do. And I noticed the tax collection rate's the highest it's ever been, so appreciate that.
Thank you.
Anybody have any other questions? Oh, Greg, I was wondering, when are you going to be sending tax bills out?
We have a cutoff date in the assessor's office for the 14th of August. And so once we get there, the scroll from them, it should take maybe another 7 days to get back some copies of all the bills to make sure they're correct. We hope to have them sent out by September 8th, no later than the 8th.
Okay. All right.
Sooner than hopefully, August 31st, September 1st.
Okay.
Do you have it in the system what it is, though, now?
Pardon
What the
me?
bill is?
No, not yet. We're still, the assessor's office is still entering their abstracts, private property, business, personal property. They're not finished with that yet. They still have some accounts to enter, but she's given them a cutoff date of August 14th.
Okay.
So.
Okay, so at this time, I'll entertain a motion to request approval of the 2018 settlement of collections.
So moved.
Second.
Any other discussion? Okay, all those in favor indicate by saying aye.
Aye.
Okay, anyone opposed? Okay, it's unanimous.
Thank you.
Okay, thank you. Okay, our next item of business is to request approval to award bid to K&T Construction Company, RLLP, for the Jonathan Creek Soil Reclamation Project in the amount of $494,238.50 to be paid from budgeted funds. And we have our program administrator, David Francis, here. Welcome, David.
Good morning, Commissioners. Hope everybody's well. Congratulations, Greg. That was a good report there. Just to give you a little bit of history about the Jonathan Creek site, just where everybody knows, get everybody up to history there. It's a 22-acre site located in the Jonathan Creek community. It was purchased back in 2007. The original intent of the purchase was for recreation, but due to the cost of the recreation program and the recession hitting at the same time, that project was put on the shelf. Since that time, the property has been used and leased for agriculture purposes, but last year we started looking at that property when the Haywood County Chamber and EDC started partnering up with the Buncombe County Chamber EDC. We realized that we did not have much inventory here for economic development use. We had the properties over at Beaver Dam, but we did not have any other properties that we could readily market for economic development use. So that spurred us to start working with the developer at the public site to try to obtain soil there. But unfortunately, that soil ended up looking more like pumpkin pie than it did soil. So we did not accept that soil. And we started then looking at, other ways to develop that property. And we had the property tested, the Jonathan Creek property tested to make sure that it could handle different kinds of weight from different size of buildings. We had two projects that were looking and very interested in the Jonathan Creek site. And one of the buildings almost took up the entire site. So that was one of the reasons I said, hey, we need to make sure that it's tested and a building could sit on there. And so, of course, those tests came back fine. We also had the Barrow site tested as well, too, to make sure those soils will be compatible to be compacted on this site as well, too. So we did the testing, and so we truly believe that this site, will be a very readable, marketable site just from the state that it was in. But, people could not see and how long is it going to take for the site to get ready. And that's one of the reasons we could not push those other two projects across the line with this site. But I think that it shows that there is interest in that site as well, too. Of course, the reason that we're doing this is because in 2012, the flood guidelines changed. 6 acres of this site went into the floodway, and the balance of the property went into the floodplain. So what the project is doing is taking soil and building it up above base flood elevation. So this project will bring the project up 6 inches above base flood elevation, where we can go back to FEMA and request that this property be taken out of the floodplain at that time. And so that way somebody can come put a building on there. This doesn't make the site truly building ready, because we don't know what kind of building a manufacturer would want to put on there. It doesn't take care of the drainage or some of the issues like that, but it would be ready to accept a building on that, and where a company would not have to come in, build up the site, and do all the work that we're doing ahead of time. So no matter what the project was going to be, if it was going to be for recreation, we were going to have soil, because we can't get the kids to play cow patty football anymore, so we're going to have soil out there too. If we're going to do affordable housing, we have to have soil to raise it up. And of course, for an economic development project, we have to have the soil to raise the property up. So where we are now is that this project will move 33,500 cubic yards from the Dennis Hall Barrow site over to there, and it will be compacted up to, as I said, up 6 inches above base flood elevation. And we submitted out to bid for this project. We had 4 bidders come on June 6th, and K&T was the lowest of the 4 bidders at $494,183.50. So one of the things, let me explain about the bid, was we had a bidder call in and said, what about the rock? But we had it already previously tested, and we don't think there's any rock in the Barrow site. But the McGill went ahead and added a rock allowance in there. K&T had already had their bid done, but they added the rock allowance in. But when they were tabbing it up, they forgot to add the $20,000 back in. So the original bid was submitted at $474, but the $20,000 was already in the bid tab. They just forgot to bring that down. It's just an error. We talked to them about it, worked through it, and then they can still hold up, of course, to the bid of $494. But make sure that you understand as well, too, that these bids are by unit pricing as well. There's 2 things in here I don't think that we will use at all. We put the extra 15,000 cubic yards in there in anticipation if we had somebody readily wanting to go into the site that needed more soil. So that 15,000 will not be used at the time. That's a savings of $90,000 on the unit pricing. And I don't anticipate using any of the rock removal allowance either. There's plenty enough area from the Barrow site that if they do run from rock, they can just go to the right or go to the left. They don't have to remove the rock. So I think there's will be a savings in there of nearly $110,000 there from the original bid, which will knock it down, to, less than 400, easy. Yeah. So I just want to make sure you understand about the unit pricing. Funds were approved in November 17 and back in November of 18 when the soil purchase for Mr. Hall was made at that time. So we have all the budgeted funds are all in place at the moment now. There's also this project too, in development-wise, is still cheaper than the Beaver Dam. Even 12 years later, still cheaper to develop this site than it was to Beaver Dam. You'd be mindful. If we're going to be in an economic development, position, we're going to have to, be able to develop property and make sites work. It's not cheap here in the mountains. Here's a flat piece of land that we had, still had a development issue. So that's one of the things that's been important. You know, CC and I worked continuously on these projects with the asphalt folks. Clark Duncan, who you've had a chance to meet, you know, knows how important these sites have because they're becoming fewer and fewer instead of more and more. And that's one of the things that's important to us to have this available for us. Things are, you know, moving really well on Beaver Dam. We've shown Beaver Dam more and more over the last 2 years than I know of Beaver Dam being shown in the first 10. So this partnership is really working, and we've had lots of movement and interest. The Asheville EDC went to another show, brought 3 leads back that we'll start working with in the late summer and early fall about our sites as well too. And you know, the focus, you know, with Asheville EDC is on here in Haywood County as well too. Okay. Any questions?
By elevating the sites, you don't have to pay flood insurance, and that's a real big, important piece of the puzzle. Flood insurance, I have to deal with this because we have to mark the flood elevations for a lot of property owners, and the flood insurance has gotten extremely expensive. I know just a normal home in Allens Creek, I've heard prices of $3,000 for flood insurance, and a family cannot afford, that's about what their house payments is a year, you know, a month. So by getting it out of the floodplain, that's a real plus. And then this is less than what we budgeted, I think last November when we did it. So the price came in less than what we budgeted. So I just wanted to point that out.
Because with the soil and the compaction, we're less than $9 a cubic yard. When we were looking at soil for the Francis Farm project, we were getting quotes anywhere between $10 to $12 a cubic yard to bring soil up there. So we're below that as well.
Anybody have any other questions?
Just a comment, Kevin. I know that what you said earlier is important. You know, no matter what we do with the property, whether it's going to be for affordable housing or what, we're still going to have to do something with that site. And what's concerning is no more inventory than what we have in the county, as you mentioned as well. You know, when people come in and they're looking, and I'm sure you'd agree with this, you and CC both, they want a shovel-ready site. And I think it's important. Whether you agree with us purchasing the property or not is one thing, but now we've got it, and I think we need to do something with it. Like I said, the inventory that we have here in the county, we live in a beautiful place, but with these mountains, you only have so much inventory for development. And then I think something that's important as well, if we get something in that or on that piece of property, we will get some tax revenue from that, so that'll offset some of these costs that we're enduring. So I guess what I'm trying to say is I think it's important. It is also only the 14 acres that we're going to be doing. Is that correct?
16.
16. I meant to say 16. I've got 16 wrote down, but I said 14. So the other part of the property could be used for parking or whatever. But this would be something we could go back and ask to be taken out of the floodplain. So I guess what I'm trying to say is I agree that it is good that it is less than what we had budgeted before, and I think it's a good thing. So,
thank you.
Okay, is anybody else?
There's no doubt it's not a popular decision, but one thing in looking at it and going down and viewing the property, a concern I have, I know when you do something, you move the water. There's a mountain behind it. We've learned this from Clyde. They had to go back in and redo the park so that things would allow the water to go somewhere instead of downtown, and it's very effective so far. We haven't had the extent of what we had in 2004. If we do this, and all of these people below that, now we don't have these 16 acres to absorb the water and allow it to spread out. There's no way to predict the future, but I don't want to see this project cause the loss of life or damage other people's property or move the floodplain somewhere else, because the water's got to go somewhere. There's no way for us to stop that. We may get us out of the floodplain, but somebody else is going to go in because of it.
The floodplain, you know, is defined by, you know, FEMA all the way down through there, as you well know. And so, we're just raising it up, where it's not in the floodplain, but that water, no matter what business come there, it will have to, by state and county, we'll have to have diversions there as well too. Where it would not be, throwing it on somebody else's property. We can't do that, because I don't think with 16 acres it would be minimal, where some water flow off another person's property is allowed. You'll have to have diversions and have appropriate drainage in there, as you would if you were building, from Walmart or Ingles up there. You'll have to have that water diverted.
Well, I know I worked the floods in '04 and spent a lot of time in the water, and the fields in Bethel and places like that, even though they were being used for something else, it in fact slowed the river down and allowed the damage to be not as severe because the areas that it spread out to hadn't been developed. This area hasn't been developed, and it's in a floodplain. I guess that's my biggest concern, is what are we going to do to somebody else?
It's, when we're, it's a little bit complicated, but when we're talking about the flood, you've got floods, you've got the floodway, which is your insurance, So in the floodway, you can't do anything without a no-rise certification from the engineer. Then the floodplain, which is outside the floodway, you can elevate. The engineers have calculated that you can fill that area without affecting the floodway. But when you put stuff in the floodway, then you start affecting people downstream by raising. It's kind of like you sitting in a bathtub, and they've designated that floodway as area you don't do anything in, because if you put something in it, it raises the floodplain on down the stream. Okay. And I see what you're saying, but the floodway, we're not doing anything with that. There's about 6 acres.
The floodway acts as a buffer. Okay. That may be too loose of a term to use, but it does act as a buffer, and that's where, it's been determined where, if there was anything catastrophic going to happen. Yeah. So you can put parking, picnic tables, personal property in there, but no structures or anything are allowed to be built in the floodway.
Well, I know McGill looked at how we accomplished the project. I would feel a lot more sure, I guess, if they had said, we do this, it's not going to affect other people. Because they are the engineers, they are the people that know this, and I know you're a surveyor and you understand that as well.
The floodway is, you don't do anything in it, and that's, a lot of people want to do something because it's creek front, right? And that's where it's pretty, and you can put a house there, and if a porch out on, you can't do that.
Can't do that, no.
Because it affects the flood, the water down, it raises it, down the stream. But the floodplain, you can't actually put something in. You just have to elevate to, elevate.
And you could still put something in a floodplain as well, but you have to, if it was a structure,
floodway,
you'd have to build up so high, to get out of that, that. See, there would be no way to put a commercial building on this and raise it up 3 to 4 feet. Couldn't do it. You might be able to take a single-family house and put, a large crawl space in there, raise it 4 feet, and that comes out of the floodplain. Okay, but you have to get it raised above there's a term there, low MRF or whatever it exactly is.
But there's no way to predict what 20 inches is going to do, especially 2 days apart.
I'm sorry.
There's no way to predict what 20 inches is going to do, especially 2 days apart.
Yeah.
But that's one of my biggest fears. The other one is, are we buying the same horse? When you look at the bids, there's $170,000 difference between the low bid and the next bidder. I did fire equipment, fire trucks, and I participated in a lot of bids. And usually when somebody came to the big table and there was a whole bunch of money between the low bid and the high bid, usually it wound up being in the middle were the people who actually did what they said they were going to do and what they were asked to do. I know McGill has reviewed this, but that seems like an awful big difference. I could see the other two, the 669 and the 700, being really close as far as the work that they're going to be doing. Is there anything you can do to reassure me that?
Yeah. Well, the one where the second bidder I thought was could not figure where the pricing was. Was for clearing and grubbing. It had $65,000 on clearing and grubbing. It seemed high. But if you go back and look at the actual dollar amount of the haul and compaction, which is at the heart of this. The winning bidder was at $767, and the next lowest bidder was at $730. And that was the two numbers that I looked at. And then mobilization was pretty close there as well. And then erosion control, that's where we spent, time talking with K&T, was about erosion control measures because of the numbers being lower than that. And, he has all the equipment in-house as opposed to having it contracted out. And that was one of the reasons he was able to bring those erosion control numbers lower than if he was going to contract it out, because the next lowest bidder was contracting all those services out.
So that makes up the difference between them, because they weren't able to provide it.
Okay. So we couldn't figure out if they were going to contract the clearing and grubbing out as well, because that number was just way high. You can see, and then there was another one. Another builder was clearing and grubbing was $3,000, and we were at, this lowest bidder was $2,000. They were at $65,000. And the next bidder was at $3,000. So that I don't know why they were throwing that number. It's like,
well, that's what I saw. And I was like, are we sure we're not going to get at the end of this? We're going to get to the point where we didn't get what we bought.
Yeah, that's what we spent time with K&T talking. Went everything through there. They double checked everything again. We asked them to as well too. And he came back and said, no, he was totally good, explained, some aspects in his bid in there, and got much more comfortable with it as well, too.
How long do you think it's going to take to do this?
It's 90 days per the contract. He says if we get everything up and running by August 15th, he hopes he can get, weather permitting, be done in 60. Because there's a penalty there. If he doesn't have it done by 90, it's $100 a day after that.
And we don't have anybody right now that's really
no
aggressively trying to find a place down there.
No, we've got two projects that we're working strongly with, and both are on the east side of county.
That's all I've got, Kevin.
I was just wanting to go over some numbers. You can go ahead, Tommy.
Well, yeah. I've kind of wore these people out. We kind of got in this airplane kind of, at 36,000 feet, and we want to land this thing good for Haywood County. Hopefully when we come out of the fog, we'll see a nice row of landing lights, and we'll have a smooth landing. But I think that's everybody's hope. But I talked to David and Kevin and Bryant and asked several questions. But this bid, I like Mr. Pless. I looked at those bids and I thought, my goodness, how in the world could you get that big of a range? Even with this bid, we've got nearly $130,000 what I'd call soft money in there, which we may or may not have to tap into. The 15,000 cubic yards maybe of additional dirt, and the 40,000 for that grid stabilization, and there was another one in there that we may or may not have to tap into. So I'm comfortable with that. And I know Chairman Inslee, I may be stealing a little bit of his thunder there. He was going to go over some data. I talked with him about the DACO, or the old DACO side. Is that what you were going to share with the
I was going to go
folks? So,
but the bids, it's just a good economy. I know those grading guys, and when the economy's good, it's like if I get that, I'm going to
pick their jobs and name their price.
Yeah, because they've got plenty of work. I mean, everybody's got plenty of work. I've got plenty of work, and you hate for the phone to ring because it's like I just want to get done with what I'm working on, and that's probably it. So, but what I was wanting to go over just on economic development, there was a letter to the editor here a while back, and it was talking about DACO and Beaver Dam being something kind of a boondoggle or something. And I thought what was interesting was we don't talk about our economic development successes enough. And for the Beaver Dam Industrial Park, and I was familiar with that because in the mid-'90s, I did surveying for the Green. It's called the Green Land Company, and it was Robert Green, which was Robin Green's Black's father, and Carl Green, and then Green Brothers. They all had this, they bought this land out in Beaver Dam, and they were going to develop it. And a good surveying friend of mine, Frank Davis, said, that'd be a great industrial park. And I was like, yeah, you're right. And then I think he talked to some commissioners, And sure enough, they were looking for industrial sites, and they bought it because it had natural gas available and water and sewer wasn't too far away. So, but we've paid over the years about $826,000 for that property is what I kind of came up to. And that was for about 120-ish acres. And so far, we've developed about 41 acres of that property, and we still have about 75 left to go. But of course, what's left is not great. We do have the one site that we graded. But so we spent $826,000 in the mid-90s, and maybe a little bit, a few years after that, we picked up a couple of tracts. But the current tax value of that property, which was just farmland, is now $15,500,000. $15 million. And just to convert that into tax revenue on the property tax and the business taxes that we get off that property the county is almost $289,000 a year is what we get off the property. So ConMat started working in 2004, and then there was a cleaners there that started in 2005, and then Rotolock. I don't think they have very many employees, but just the number of employees at ConMat right now is 700, which Dayco I think was 750 when they closed. I might be wrong about that. I'm going way back, but so we have. And then we have the other two. I don't know how many jobs Ameripride Services have, which is used to be Sprinkle. He had his dry cleaners there, and then the cleaners that did it wasn't dry cleaners. I guess it was like they did towels and sheets and things like that for businesses and hotels and everything. So they have employees, but so we've got probably 800 employees, I would guess, that work at that site. And that's why we did it. It was for jobs, not for tax revenue, but we're getting $289,000 off that site. And to me, that is a success story because they invested $27,000. And so the return every year is almost $300,000. So in 3 years, they got their money back, and this has been going on since 2014. I mean, for 14 years since 2005, 2004. Now, the old Dayco site, the county and the town bought that in 2002, maybe, And the county and the town of Waynesville, they went together and they spent $1.2 million on that site. And at the time, everybody was, it was a brownfields, which meant the state had identified problem areas on that site. So it had some ground contamination because of the plant that was there. So the county paid $1.2 million, and everybody was, complaining about that. And then the county was to work with the state. They got rid of the brownfields by encapsulating and doing what they needed to when they did the development. And currently, the tax value at the old Dayco site is $37,300,000 right now on that site out there. So, and more importantly, and then our tax revenue from the county standpoint, we get $260,000 a year of tax revenue off of our $650,000 investment that we made. So in 3 or 4 years, we've got our money back. The county has got their money back, but more importantly, Walmart has around 385 to 390 jobs, as best I can tell. And then Best Buy, I'm not sure how many jobs they have. I know I saw something online where Belk's had maybe 55 jobs, but you've got all these jobs that are there. They're mostly retail, so they're not great paying jobs, but Walmart does have benefits. In fact, I have a cousin that works there. I should have called him and found out some information, but you have Best Buy, Walmart. We have the ABC store, which is really tax exempt, but you still have some employees there. And that site, when it's not an ABC store anymore, it can be used for something else. You have Verizon, and you have U.S. Cellular, you have Rack Room Shoes, of course, Belk's, you have Michael's. I'm not sure how many work in that store, probably several dozen. PetSmart, probably the same way. You have a car wash there, probably doesn't employ very many people, but then you have a beauty supply place, Verizon, GameStop, City Financial, and Sally Beauty Supply. So you have about 18 businesses at that site. And you probably have, I would say, 600 or 700 jobs there, which is why we developed that site. The town of Waynesville probably receives, I would estimate, $200,000 in revenue on their $650,000 investment because it's in the town. So basically, that shopping center that was supposedly a boondoggle, we don't talk about this enough because it's economic development lifts, it truly does lift all boats. But it revitalized Hazelwood. Hazelwood was just dying. You know, all the plants had left there. It's a great town to live in because it's affordable, you know, workforce housing, but still just not a lot going on there. But probably one of the more important things also is probably the majority of the Haywood County's sales tax revenue comes from that site. You know, that was an old factory that was just totally, you know, not. I mean, it was out of use, just a bunch of big empty buildings. So, but the county, and it took us about 10 years. We didn't sell that to 2011. So since 2011, you know, we're reaping over $200,000, not $260,000 a year in tax revenue from property taxes. And like I say, that does not count the sales tax revenue that we receive. It does not count the jobs that's there. And then, but those two sites bring the county every year $550,000 in property tax revenue from economic. That's two of Haywood County's economic development projects have been hugely successful, at least in my mind, and I'm from the private sector, and to me that's a lot of money for a pretty small investment. And then also, we had a few years ago, and I think Brandon was on the board. He might have been on the board when we did it, but we gave $200,000 to Freightliner to help develop their site. And right now, currently, they have their property's worth $2.1 million. And I'm not sure what the tax revenue is on that, but and I think the town of Canton helped us with that also. That was another partnership. And I think there are 35 to 60 jobs, or I think they started out at 35 and
45 right now.
45 jobs? Okay. So, you know, that was good paying jobs. I've told people my son-in-law is a diesel mechanic, a pretty good one, and he does very well at, he works in Candler at the one at the exit there off exit 44. So I believe it's, I forget the name, Kenworth, I believe is the brand. Correct. So anyway, he works there and does, you know, really well, loves his job. And I know he's got friends that work at Freightliner that really love their job. And it's a great job, and they live in Haywood County, and they work in Haywood County. And then just recently we had the CBD oil manufacturer come in, which is going to be a $10 to $12 million investment in the county. Correct. So that's a successful story that we really didn't have to put a lot of effort in, that we worked with CC and the Asheville Chamber, I guess, and everything, and they brought that business in. So our economic development efforts, I don't think we brag on them enough because they're out there, and, you know, people, they kind of make stuff up about it, but it's, you know, the numbers and more importantly, the jobs is what we're after. You know, they'll come if we just have sites available. So, and we've still got a great site at Beaver Dam. It's been there for a while, but you know, man, the jobs and the businesses we have there now is just, it's just huge. So I think you know, I'm in support of this project, but of course, I think it's a little bit, you know, further out in the area and stuff, but we do have interest in that. And if, you know, in the end of the day, if we don't use it for economic development, we can use it for workforce housing. I know David's talked with Cherokee. They've got a lot of jobs over there at Harrah's, and they're having trouble finding housing and everything, and that's just a big problem. So we have that in our back pocket, and we'll get our money back from that. And then you're going to have revenue from you know, property tax revenue for, you know, 100 years or more. So, but anyway, those are some, I believe I've covered everything, and I've probably talked a long time. But I just want to point out our successful stories in economic development. It's a real positive for the county, and we're providing, the main thing is we're providing jobs for everybody. So, does anybody have anything they want to add?
I just want to you know, say one more thing. You know, with the partnership that we had, you know, the important part of that is the marketing. Because, when we made that partnership with the Asheville folks, it gave us a new level of marketing. And I mentioned to you earlier that we had not had the visits and the people interested in Haywood County until we had that partnership. And that, that's a lot of credit to Cece back there, for, making this happen. And so, now we're on the right track for marketing. I'm not worried about Beaver Dam. It's going to go. But what are we going to have to market the next time? That's what I'm worried about. And I think that's why this is a good fit. Or in finding actually, we're going to have a conversation about finding other properties. And we're going to do it in another park sooner or later. Because, it's going to be that time.
Well, I think some of those numbers Kevin said and some of the other comments, I like quotes. And Bryant told me one the other day I hadn't forgotten. He said a leader plants a tree knowing he may never live to sit under the shade of it.
Yeah.
So I like that quote. You got to be a little visionary, and I know it didn't really work out the way it was initially intended, but hey, we've got options. So a leader does plant a tree sometimes, and knowing he never will enjoy the shade that it will cast. So that's a good quote, Bryant. Thank you.
I still on mine too. Okay. Well, and it's, economic development, we have some successes, we just need to point them out, but it takes time. I mean, we're talking, those commissioners in the 90s, probably most of those are gone now, and now, the fruits of what they did then is really, come to fruition and stuff. So, and then the DACO site, that's really been a really huge success. Considering it was a brownfields, and people, if you'd have had a business come in, they're like, no, I don't deal with that, and they go somewhere else. Yeah. So,
when I brought that idea we had a joint meetings back in the old building between the town and the county, and when I proposed this first idea to them about the turning the DACO, buying the DACO property, there was not only, I had 20 different eyes going across at me at the same time, looking at but there was no other chance it would ever have, as you said, to buy, that piece of property, $1.2 million, and put that property in the county's control, because we saw what happened when, DACO sold it to Mr. Moses, what all was going on there with that. And, so, it does take just sometimes, thinking outside the box a little bit, but I think that's worked out well. Beaver Dam's going to turn around as well for the county as well, too.
Yeah,
so I'm pretty happy.
Yeah, I didn't even mention the county. The county sold the property to these people and made money on that, too. I forgot about that.
Yeah.
I'm just talking about the revenues that we were getting.
Yeah. Yeah, that's true. Yeah, because the sales from all three of those properties actually paid for that $800,000. Actually, the sale of that property paid for the original cost as well too.
Yeah, it did.
So,
It really did. So okay. Is there
just another quick comment? I know sometimes it's not fun, when you have to spend this kind of money. But as you can see, there's a lot of benefits that you can reap later on. As a business owner myself, I'm looking at expanding right now and adding a couple more bays at my shop. And I don't like the numbers that I'm seeing, but I know that down the road, I'm going to get some of that shade. So, or I probably won't, but my kids probably will. but sometimes I
can't find time to sit in the shade, Brad.
Well, I can't neither. That's what I told them yesterday. I'm busy planting that tree, and they'll get to sit under that tree one day.
Well, you need to come to Waynesville and plant some trees, Brandon. That's what I say. Doesn't it, Kurt?
Yep.
Okay. Any other comments or anything? Okay, here and then, and we're just approving the contract on this. We'd have budgeted these back in November.
So you're approving the award,
The award. Okay.
To K&T. In November of 18, you signed the rest of the project over to the county manager to execute the contract upon the award after that. So.
Okay. Okay, so I'll entertain a motion to approve to award bid to K&T Construction Company, RLLP, for the Jonathan Creek Soil Reclamation Project in the amount of $494,238, no, it's $494,238,000 and I probably said that wrong, but it's in there. So, yeah. Okay.
So moved.
Okay, is there a second?
Second.
Okay, is there any other discussion? Okay, all those in favor indicate by saying aye. Aye. Anyone opposed? Okay, that's unanimous.
Thank you,
Okay, thank you, Dave. Okay, our next item of business will be our appointments, and we have to request a reappointment of Andrew Sanderback to the Library Board of Trustees, and we have our county manager, Bryant Moorhead. Okay. Okay. Is there any questions for?
There was a committee that reviewed the applicants for the appointment and came out with Andrew, and he's been on our board, like I said, for the last term, and he's a great asset to the board, and it was unanimous approval that he be submitted, or requested his name be submitted.
Okay. Okay, so I'll entertain a motion to reappoint Andrew Sanderbeck to the Library Board of Trustees.
So moved.
Is there a second?
Second.
Okay, all those in favor indicate by saying aye. Aye. Is anyone opposed? Okay.
And I would say on behalf of the library board publicly that we appreciate the other applicants, and that those applicants were good applicants as well, but at the end of the day, you can only choose one.
How many did you have?
3.
Wow, okay. That's good. That's good interest. Okay, and I understand how hard that is because we have to point people, and sometimes you'd like to point all of them. Okay, the next one is to request the reappointment of Virginia Boyer to the Adult Care Home Community Advisory Committee for Long-Term Care. Okay. Any questions about that? We appreciate those people to serve. A lot of these boards are they're hard to get people to apply for, and we appreciate Virginia Boyer doing that. So I'll entertain a motion to reappoint Virginia Boyer to the Adult Care Home Community Advisory Committee for Long-Term Care.
So moved.
Is there a second?
Second.
Okay. All those in favor indicate by saying aye. Aye. Okay. And that's unanimous. Okay, we have no closed session today, so is there any other business before the board today from anyone?
Just one comment. We had a member of the Fines Creek Community Association here. I think we smoked her out. We went so long, but she may watch it on the video. Miss Hammett was here standing in on behalf of the request for the $75 reduction on the building permit for that handicapped ramp. And I will say those folks take pride in their community. My wife and I enjoyed a nice fish dinner down there Saturdays a week ago. Trout, catfish, all the fixings, and those folks really are working hard to keep that facility going, and it's kind of a hub to their community down there. So, Ms. Hammond, if you're watching, we appreciate you coming, and we're glad to help you out with that handicapped ramp. And on that comment, I'm kind of curious why we even charge $75 to a nonprofit. It might be something we want to look into, but.
Well, yeah, if they ask the board, we generally can approve it. Yeah, so it's churches, and but they have to ask. It's kind of like Greg will tell you. There's certain tax programs you can take advantage of, but you got to ask. We're not going to volunteer for you. So, but if you ask, yeah, that's good. That's good. I do appreciate the community clubs. Karen was here. I meant to point out that she was here when I read through all of them, but she's pretty spunky. She's really involved out there, and we appreciate her and her involvement. Okay, is anything else? Okay, yeah. Hearing nothing, I'll entertain a motion that we adjourn.
So moved.
Okay, second?
Second.
Okay, all those in favor indicate by saying aye.
Aye.
Okay, we are adjourned. Thank you all.